Hey OTs, my name is Jennifer DeYoung and I'm an occupational therapist with over 25 years of experience, and I've been a hand therapist for nearly as long. So I was thinking about different qualities that can help you know if you'll be successful in and enjoy a particular specialty area of OT. As I said, my specialty is hand therapy, so I feel like I can speak best to that. And in no particular order, a couple of traits that I'm thinking of are, number one, and this is true whether you'd be in an outpatient or inpatient setting, is you need to review your patient's case before you see them. So is that really a trait? It's just more of a habit of reviewing, actually. So before you see them, you need to have plans ready to go for that day, and not just one plan, but like plans A, B, and C. And you'll need to understand the importance of then testing your patient, treating them, and then retesting, especially in outpatient orthopedics and hand therapy, because you'll need to know what your next move is going to be, and that will help to inform you of that. So in other words, whether you should stick with your current plan for the day, or if you should go ahead and progress them because they're doing better or better than expected, or maybe they've had a setback and you're going to need to scale things back a bit. So test, treat, retest, and you learn how to do that with specialized training. Number two, especially in hand therapy where you don't have much education in your general OT studies in school, is that you really have to be diligent, motivated, and hungry to learn and spend a lot of extra time outside of your work hours to study and research and to connect with more experienced hand therapists. And doing that, you need to be humble in those connections. So there are a lot of resources out there that were not available back when I was starting out. So I feel like acquiring that information nowadays is a lot easier than it used to be. So again, recognize that it does take time, and you have to have the willingness to be a sponge and learn. And number three is to have creativity with your therapeutic activities and interventions, and not just for the sake of showing off that, you know, you're a really creative person, but to tailor your interventions to your patient's needs and their goals. Creativity is also really important when it comes to fabricating orthoses, splints, because you may not have the fanciest materials available to you at that moment, but you need to work with what you have. You need to make it visually appealing, and you know, approved by your patient. This is something that they're generally going to be wearing and using in public. So it's like having your signature on everything that they walk away with.